Good afternoon, everyone. I am Tiffany Marley, Project Director for the Learning Communities Resource Center here at Community Action Partnership. And we are happy to welcome you to today's webinar, the Futures Project Session 1, Clarity, Impact, and Performance. We will be joined by agency presenters, Elizabeth Jennings from Community Action of Scotty County, and Claire Seguin, the Oregon Housing and Community Services Organization. So before we dive in to the wonderful content to be shared during our presentation today, I'd like to take a few moments to just highlight what the purpose or focus is for the Learning Communities Resource Center. At the core of what we do is to really analyze community action outcomes and identify effective and promising practices that address both the causes and the conditions of poverty, keeping in mind that anti-poverty work rests at the heart of who we are and what we do as the Community Action Network. With that said, we would be remiss if we did not engage in stating the community action promise, or the promise of community action that really grounds this notion of who we are and what we do as a network. And that promise says, community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. And so with that in mind, the Learning Communities Resource Center has hosted a series of webinars. Really, the webinars have intended to provide you all, as members of our network, with specific anti-poverty approaches and to showcase those innovative or promising practices. The Futures Project is a part of the Poverty Trends Learning Community Group. Many of you have been involved with Poverty Trends, which has been led by the Center for Community Change, Jim Masters and Alan Stansbury, and they will continue to offer segments of the Poverty Trends content, but we are pleased that the Futures Project will be adding on to the conversation related to this larger conversation around poverty trends. And ultimately, the Futures Project believes that using data and a common language to tell our story can advance the clarity, impact, and performance of the work and really strengthen community action agencies' efforts to help families to move out of poverty. And so with that said, I want to take a moment to talk a little bit more about that. And so we can all acknowledge that as a network, the anti-poverty work rests at the heart of what we do. I've already articulated that. If we are not mindful about those innovative or promising practices that inform how we seek to combat poverty, then we are not as effective as a network. In the same way that we are thinking about the what of what we do, which is fighting poverty, we also have to be thoughtful and mindful about the how of what we do, which really lends itself to performance management and effective management practices. A key aspect of the performance management framework is Roma Next Generation, Roma being results-oriented management and accountability. Next Generation, we use shorthand language when we talk about it. As community action colleagues, we call it Roma NG, which suggests that we are, like I said, engaging with the result-oriented management and accountability cycle, or the Roma cycle, in an ongoing manner, and also we are engaging that cycle at every level of the agency. So from the work of the board all the way down to frontline staff and even to the experiences of the customers that we are hoping to move forward out of poverty on a daily basis. Another key aspect of the Roma Next Generation concept is the national theory of change, which is really an articulation of the underlying beliefs and assumptions that guide service delivery strategy. So the national theory of change, or we also call it the community action theory of change, which you see on the screen, really attempts to identify the why and the how of the activities undertaken and identifies what of change and improvement is produced. And so basically the community action theory of change makes what is in some cases a complicated system easier to understand. It unifies the work of the Community Action Network. It articulates our core principles and identifies our national goals. And so with this in mind, we have also engaged in this performance management framework, or this Roma Next Gen framework, particularly through the community action theory of change or the national theory of change, with the notion in mind that each community is different. Each state is different, each region is different. And so given that reality, this statement can be adapted for specific needs and approaches by local community action agencies, which brings us to our conversation today. And so let me say a little bit more about the Futures Project themselves. So established in 2014, the Futures Project is a peer-to-peer effort. And so they are a group of community action agencies and state associations who have basically sought to encourage the exploration of reporting good outcomes in a consistent manner in order to tell a coherent story. This has been an organic process for these agencies who have been involved in the project, and their approach provides one of many ways that agencies and states might think about creating and implementing local theories of change. And I want to say that this effort represents one way that individuals or agencies might engage in developing and implementing their local theories of change. The key is that now that our national theory of change, our community action theory of change is in place, we have it as our North Star. So we see it as a guiding force as we think more specifically about our local assumptions, performance indicators, and strategies as a network. Our big goals remain the same, which are individuals and families with low incomes are stable and achieve economic security. Communities where people with low incomes live are healthy and offer economic opportunity, and people with low incomes are engaged and active in building communities. For those who are interested in learning more about the National Community Action Theory of Change and even how to create a local theory of change, resources are available at the NASCAS website. If you go to www.nascas.org, those resources are there, and definitely take some time to look at those and think about those wonderful resources in relation to the conversation that you hear from your colleagues today. And so the Futures Project is a collaborative initiative equipping community action agencies in Ohio, Oregon, and Washington to tell their collective story of how they are building a new future for people affected by poverty. They believe that community action agencies everywhere change lives, and Futures believes that using data and common language to tell the story can advance clarity, impact, and performance of the work to strengthen communities, to prepare people to exit poverty. And so today you'll have an opportunity to learn a little bit more about this, and without further ado, it is my pleasure to introduce your colleagues today, Elizabeth Jennings and Claire Seguin. I'm gonna hand the torch over to, is it gonna be Elizabeth first? Claire?
Take it away, Liz. Introduce yourself.
Okay, thank you. Welcome.
Oh, hey, Liz.
There we go. Okay, thank you. I was still muted. So hello, everyone. Really exciting to see that there's nearly 90 people on this call. I'm Liz Jennings. I'm Community Engagement Manager for Community Action of Skagit County, which is a rural county about an hour and a half north of Seattle, up really close to the Canadian border. And so we're greeting you from the Pacific Northwest to share what we've been doing here in Washington State, Oregon, and Idaho.
Thanks, Liz. My name's Claire Seguin, and I'm calling in from the beautiful state of Oregon, and I'm the Assistant Director for Housing Stabilization here. And my world at the state of Oregon really consists of overseeing all of our anti-poverty programs, our homeless services, our energy and weatherization work, and I also have the privilege of working with our asset building program, the individual development accounts, which is a very successful program for the state of Oregon. So my role here now is just to sort of set the stage for our presentation. So next slide. We're going to be dividing our presentation into 3 different parts. And the first part is just going to be a little bit of the background that Liz is going to give, and then I'm going to talk a little bit about implementation, and then we'll both sort of wrap up with what we can hope for the future, for the future's work. But before I turn it over to Liz, I wanted to just share sort of a personal thought about this work. I've been involved for probably almost 2 years now, and it's been going on for almost 4, and we'll talk a little bit more about that. But I think that for me, one of the most important elements of this work is the fact that 3 states, their associations, and all of their agencies are engaged in the same work together across borders, across boundaries, to try to come up with ways to do better work for the folks that we serve. And I think that that fact all in itself is a really important part of this work, and I don't ever want to underestimate the strength that working together brings to this effort. And it's just no small feat that we are all still at it hard and looking to the future together across the Northwest. So I just share that as a thought, because I think that if you embark on work like this, it's important that you all are committed and strive to work together to make the best possible outcomes, and it really pays off, as you'll see over the next few webinars. So Liz, how about you go ahead and set the stage by sharing some background?
Sure, thanks, Claire. So I came to this work in 2012, and I'm so happy that colleagues in community action have been laying the groundwork well before then. The background, the why question of, we all are trying to improve our work. We're all trying to measure outcomes. So why now? Why these 3 states? So first off, here at Community Action of Skagit County, our executive director, Bill Henkel, early in his tenure, I believe it was 2009, 2010, maybe even a little earlier than that, was asking some of these same questions with our colleagues across the country, and then went to a leadership development program for nonprofit leaders in Washington State. And there was an economist there. This was during the recession, and the economist showed a graphic that Bill now refers to as the jaws of death. And the jaws of death, if you can imagine an alligator's mouth being open, the upward slanting angle was the upward trend of federal spending, and the downward jaw was the decreasing federal revenue. And the challenge that the leader of that session, the economist, put to all of these nonprofit leaders in different sectors was, what are you going to do about it? So there were these external pressures, obviously funding cuts at state and federal levels during the recession, eroding funding from the 80s even to now. In addition to that, President Obama, in his first presidential address to Congress, the State of the Union, called out community action agencies by name and basically said, hey, we need to make sure that what we're investing in works, that he's committed, or that administration was committed to helping raise people out of poverty, but that they wanted efficient and effective organizations. So we all knew that. We want to do good jobs and prove our worth, but we were also getting called out with these external pressures. So we have our own drive for continuous improvement to test our theories and make sure that we're doing the best we can, those national pressures. And then locally and statewide, we got involved in part to try to get a unified voice around advocacy. At the state legislature, our local representatives wanted a unified message from local nonprofits, not just a bunch of different organizations going for this piece of the pie or that piece of the pie to help end poverty. They wanted to know, what are we doing together and how are we measuring success in Skagit County? Same questions are being asked of WASCAP, the State Association of Community Action Agencies, and we know those same questions are happening federally. So those were some of the pressures, internal and external, to drive us to ask these questions. So really, the goal is what Hyacinth set up for us and what Claire outlined, is that too often, I think the first couple of times I heard somebody else talk about community action, it was a litany of programs. It was a list, and we do this, and we do that, and we do energy assistance, and we sponsor the WIC program or early learning, depending on where somebody is. And the list, because we're supposed to be responding to local needs, is different everywhere we go. So if the list of programs is different for every community action agency, maybe a few that are similar, how do we actually talk about our shared outcomes? So those were some of the driving questions. We wanted it to have measurable outcomes about people's lives, even if we don't walk alongside them for their full journey out of poverty. And we didn't want to just be responding to those outputs that some of us get frustrated that our funders, grant makers, and others are just asking us for outputs, service delivery information, and that doesn't tell us anything about how we're changing lives or changing programs. I'm sorry, changing lives or changing communities. So the partnership was formed in 2014, and before Oregon, Washington, and Idaho all came together, we were involved in these questions in different ways. So we're all taking bites out of the same big elephant from different directions. In Washington state, we were really trying to define who we were and what our common client and community outcomes were across these diverse community action agencies serving, urban and immigrant communities, rural, multi-county, vastly dispersed counties in eastern Washington. So we were asking these questions and saying, the key question was, why do we do what we do? So what? What does success look like? So we were focused on the theory of change question that Hyacinth teed up. In Oregon, they were doing some great work on another piece of this question, another part of the elephant. They were looking at what are evidence-based outcomes. They had a scholarly approach to it, and were really focusing mostly on the client side, like how do we measure success for our clients. In Idaho, there was a push for statewide data collection systems so that we can actually compare apples to apples and oranges to oranges, instead of all of us defining micro-locally what success looks like, maybe using NPIs or other measures to guide us, but ultimately we don't have one system where we could be comparing our results and learning from each other and from ourselves. So those three approaches were already in motion. And I'm going to step back and say that when we were doing this work in Washington State, we were looking at the theory of change side, the highest level side, and to do that we have to start with our assumptions. What do we believe about families and individuals experiencing poverty? What do we believe about poverty? And in that exercise, you know, basically we came down to poverty sucks. Evidence shows us that poverty is traumatic and has very negative outcomes for people's health and well-being and their family's ultimate success. We also knew on that family side that success is unique for each family. And one of our partners, HopeLink, chewed on this question for a while, like a year. They had a PhD doing a literature review that said if community action is charged with helping individuals and families achieve self-sufficiency, what in the heck does self-sufficiency look like? And as you can imagine, and as many of you probably have learned in your own work, our assumption came down to we can't answer that question. Self-sufficiency is unique for every family, and it changes in our lives. We might be born into poverty or die in poverty or have ups and downs. And so what does self-sufficiency look like for a family? And so we just decided that success is unique to each family, and how might we measure that? So we started inching closer to this idea of stability and equipped. Stability of individuals and families as a success point, and equipped to exit poverty for those who are able to move on that pathway out. And we recognize that stability is a wonderful outcome for some individuals and families and our community, even if they're not able to get out of poverty. And in particular, we think about seniors and adults with disabilities, folks who are unable to work. If education and employment are pathways out of poverty, there's some folks that just aren't going to get there. So we had to look at stability as a worthy success point in and of itself. It costs our communities less, and it has fewer negative outcomes in individuals' lives if folks can achieve stability. But we also knew that people have lots of skills and experience and capabilities, and if we provide tools and resources, that many families are able to exit poverty. So that's how we started through our assumptions, starting to inch towards the two parts of the client side of the model. Now, in these conversations, we also were asking questions about our communities. And the conversation was very focused in Washington State on the client side, as well it should be, because that's where our focus typically is. But some of us remembered back to our roots and brought up that community is key to the community action model. And so if we're going to come up with a theory of change of what success outcomes look like on the client side, what do we need in the community to be in place for those folks to be successful? So the idea here is we can stabilize and stabilize and stabilize. We can equip and equip and equip until the cows come home. But if our communities do not have living wage jobs, affordable housing, equitable pathways to education, robust health care and family support systems, we will see those same families coming through our door for the stability and the equipping. So our success as an organization and our client success also depends on the community success to address those larger upstream issues. And so that's why the second half of the theory of change that we've developed in the three-state partnership has two sides to that. And I just want to go one step deeper before doing the big reveal on our theory of change. So why stable and equipped as success outcomes for our clients, and why community outcomes on the other side? So many of you, like me, may have your nice, gray, shiny Introduction to Results-Oriented Management and Accountability book sitting on your desk, right where you can grab it. And in the front part of that, it reminds us of the mission and model of community action. And it's three parts. We're only covering two in this theory of change, but there's three parts to this model. And in the Office of Economic Opportunity rules, it says that the community action model has three parts: the family, the community, and the agency. So as we're having these really great generative conversations and getting some pushback on how much we should focus on the community side, or questions, legitimate questions of how much capacity does any community action agency have to do to engage the community work. Like, we don't want to set ourselves up for failure by claiming to have outcomes in something if that's not something all of us can do. We were having really good, challenging conversations. And we brought it out and we actually re-examined it. So for those who don't have this memorized as the Pledge of Allegiance, that rule says that, yes, on the one side, to stimulate better focusing of all available local, state, private, and federal resources upon the goal of enabling low-income families and low-income individuals of all ages in rural and urban areas to attain the skills, knowledge, and motivations and secure the opportunities needed for them to become self-sufficient. That's the family side of the model. Self-sufficiency, which we've just explained is not measurable. So that's how we got to stable and equipped. But on the community side, it says, the Economic Opportunity Act thus gives community action agencies a primarily catalytic mission to make the entire community more responsive to the needs and interests of the poor by mobilizing resources and bringing about greater institutional sensitivity. And here's the part that makes the hair on my arm stand up every time. A community action agency's effectiveness, and that's what we're talking about, is how do we measure effectiveness, therefore, is measured not only by the services which it directly provides, but more importantly, by the improvements and changes it achieves in the community's attitudes and practices towards the poor. So we're supposed to be measuring change on attitudes and practices towards the poor, and in the allocation and focusing of public and private resources for anti-poverty purposes. So how do we measure community change? That was a really challenging question, but that's what led to the model. And at this time, I'm going to ask Hyacinth to send you the link to this. If you haven't already been able to explore the theory of change from our Futures project, this is it. It's pretty simple, and it's really adaptable. And originally, we had two sides, kind of left and right, where we were trying to mirror the client success points and outcomes with the community. And it's evolved over time that the community is kind of the foundation of the individual and family success. So this theory of change, up above, you'll see that we have those, if we were thinking of it as a logic model, the impact points are healthy individuals and families and healthy communities, long-term impacts, right? So the success points, the shorter term but long-term success points we're looking for on the client side are stability and equipped for success, equipped to exit poverty. And so we took time then, and this is about the time that we started partnering with Oregon to really ask the questions of what does the evidence show, what does research show is evidence of stability and equipped to exit poverty. And so that's how we came up with these models where you'll see that most of the community action kind of typical program areas are those bubbles. And down below, it has the impact point of healthy communities with success points of engaged community members. So this is how we help the community learn about poverty through our outreach and education. We help mobilize folks, individuals and groups through volunteerism and advocacy, and we engage those folks through giving and philanthropy to help support changing our community. To change the community, though, we also need shared vision. And that's where the coalition work happens, and what some of our rural partners called strategic initiatives or strategic partnerships. It might not be formal coalition work, but it's coming around a community need. What have we discovered in our low-income needs assessment, and how do we solve these problems together as a community? That it's not just a need or a gap that community action needs to fill, but what are we doing as a community? And then that hopefully leads to those improved services and resources and coordination that changes our system, where people understand their role in ending poverty or stabilizing lives, and our local systems and institutions actually support it. So this is currently what collectively Washington, Oregon, and Idaho have come up with as our theory of change. And as we go through today, we're going to talk about what that looks like on the ground and how it's changed and changing some of our organizations and what we have left to learn with one another. So again, we're really talking about getting clear on our purpose. How do we talk about this consistently within our own organizations and as a statewide coalition? This has changed radically. Now, up and down our organization, everyone is talking about, what do you do at Community Action of Skagit County? It's no longer, well, I'm a clerk in the WIC program. And Community Action does this other program and this other program and this other program. It's, here, let me tell you about how our health services are helping to stabilize lives and connect folks to resources so they can get out of poverty. We're all using that common frame internally and externally. And one other quick, I'm going to go back to emphasize. One of the great conversations we had when we were putting this theory of change together is how scary this is, right? Like, that's a lot of stuff that we're saying needs to happen for individuals to get out of poverty. Is this what we're committing to as individual agencies? Like, do we have to do it all? And the point is that this is not a community action theory of change. This is a community theory of change. And we might only be able to do one or two pieces of it and try to connect the dots as best we can. So then the question is, on the community side, what are we doing to help our partners or other entities fill in those other gaps? So it's a community theory of change. It's not a directive that every community action agency has to do these things, but this is why we do what we do, and we're a part of the solution. So again, the logic is, on the community side, changing attitudes and practices, institutions, systems. We need to realize that we can't be successful in our stability and equipping work unless the community work is being done. And we really need to be looking at, what are we learning, continuous improvement. And I should say, in addition, the question has come up, all right, I get it. We've got the individual and family side that we're charged to do, the family part of the community action model. We've got the community side. The third part of the community action model is assumed in this and isn't external, but it's essentially how are community action agencies effective and efficient and high impact organizations. So that's the third part of the community action model, but I just want to point out it's not showing up on this particular theory of change because that's so different among individual agencies, and it doesn't have that broader community impact, whereas we know that our client success and the community success takes the whole community. So with that, I will turn it on over to Claire to talk about how, from that development, how have things been moving forward.
Thanks, Liz. You know, this incredible collaboration to get to the point of having a theory of change that we all could focus on and agree on is just one success that we've had, and it was really built on the fact that each of the three states, as Liz mentioned, sort of brought one unique area of focus to the table, and we were able to leverage all three of those areas together to really move this concept along. So Oregon's unique contribution was this relationship that they had with Oregon State University. We are really fortunate here to have a couple of top-notch research schools who were willing partners in some of this quest for new information. And specifically, we worked with Melissa Torgerson and Bruce Weber on this project, which was a labor of love for both of them, I know. What I'm going to do is just give you kind of a brief timeline and then dig into some of the work that they did in a final report that we have available. And I'm sure that if you're interested in following up with this, we can make a link available to you all. In 2013, the Community Action Partnership of Oregon, which we fondly call CAPO, approached OSU, Oregon State, to assist in developing statewide indicators that would do two things. One, it would demonstrate the community action impact on households in poverty, and two, it would help local agencies better utilize the data for continuous improvement. So by the end of 2014, CAPO had joined forces with the other community action agencies in Washington and Idaho to begin this collaboration more robustly around determining the indicators that might marry up with the theory of change work. So in May of 2015, the indicator research work was included in all 3 states, and their research efforts, as you can tell by our various appendixes in this report, were robust, to say the least. The research in general between 2015 and 2016 was iterative in nature, and what we have all committed to throughout this entire process and going forward is the concept of continuous learning and continual improvement. We know that what we know today is not going to be as good as what we know tomorrow as we begin to use these indicators and multiple dimensions of research. The report specifically breaks out a few key things that I want to illustrate for you. The first is that the research work as a whole is framed around multidimensional poverty. And this was a decision that was made over time and great discussion to really begin to frame our thinking and our work from this particular perspective. And applying the multidimensional definition of poverty really requires that community action agencies look beyond income when they're measuring individual and family outcomes. So, for instance, instead of improving housing, healthcare, transportation, and education solely as a means to increase income, the changes in income are measured alongside changes in housing, healthcare, transportation, and education. And so with a lot of deliberation and academic research and rigor, the steering committee went back and forth and had some very important conversations about the nuance of all of this. We ended up coming up with 13 dimensions of poverty, and you see them reflected in the theory of change in a slightly more refined way. But in the report that OSU did for us, we landed on housing, health, mobility, income, safe and thriving children, financial resilience, and that's sort of where the assets work lives, legal status, social networks and connections, education, employment, and then one that got added on sort of late in the thinking, which is basically having influence over your own life. Self-efficacy was the 13th dimension that was added. So once we agreed on our multidimensional poverty list, we then began to determine all of the indicators that might tell us more about whether or not we were being successful in our work. And we also then had to research all of the data that was being collected, what data should we be collecting that we're not collecting, so that we could match our results and our interventions, our indicators to the dimensions of poverty, and really begin to get a sense of how we might be able to track how well we were all doing. So once we began to sort of figure out all the places where we had shared understanding, the places where we had gaps, we were able to begin to put some tools together that demonstrate the impact of these measurements, and to talk about how to make data collection more simple to do, if you will. So then generally we had to sort of work within the existing universe that we all live and breathe, and that is to work with the national folks to talk about how we're going to align the realities of what we're finding through this academic research, and then the steering committees and the associations on the ground sort of feedback. We needed to determine how we were going to align that with the CSBG, NPIs, and all of the other work that was going on nationally. So all of that is addressed in great detail in this report. So I encourage you to take a look at it. I think you'll find that the way we have proposed using the measurements is very helpful, and it's very well organized, and I think that it would give you a really great grounding about how to maybe look at the work you're currently doing in your agencies or with your state associations. I think one of the things we all hope is that we're trying to make this replicable, simple to understand, easy to assess, and easy to improve upon over time. So if we go to the next slide and we talk about the research findings, at the end of the work that Melissa and Bruce did from OSU, they came up with 4 sort of key findings that are called out in the report. And the first one is probably apparent to us all, and that's that many agencies are not going to be able to tackle all of this at once. Talking about biting, eating the elephant one bite at a time. I mean, this is big work. This is big change. And to do it right and to implement it throughout your agency is no small task. So we recognize that not everybody could go forth and make these changes all at one time. Number 2, we also recognize that we needed to have some early adopters so that we could test some of these data collection and reporting ideas and begin to share the stories that we're finding. Because, of course, fundamentally, one of the primary purposes of all of this work is to be able to tell a better story and to be able to analyze our stories and our impacts in a way that make us better at what we do. And then the third point, of course, is to document all the learning so that we can provide a roadmap for folks who want to become engaged or who are engaged to be able to track their progress over time. And then lastly, it was called out that the state associations and the government agencies can help with this work in meaningful ways. And I think that our collaboration by having the representations from all of the folks who are involved in the work has really proven that to be true already and fundamentally. So we know that there are different roles that we all play, and if we all focus in the same direction and we're all committed to the same theory of change work, that we can really make a difference by defining our individual roles in that formula. So then the next slide. So where we took those recommendations really was to take a logical step and start a pilot program to implement what we were learning. And we decided to work with 2 agencies in each of the states. We tried to recruit a real diverse representation geographically, the size of the agency, those sorts of things, and to begin to put them through a process of continual learning about their own data collection and to help them identify their gaps and work through a process. We wanted to help everybody begin to align formally how we're going to report out on our new indicators and how they match with the MPIs and the Roma work, and to call that out and to build that into our systems and see how easy or hard that is. And then one of the things that I think is really important about the pilot project is that the approach was to include staff at all different levels in the organization to hopefully instill continuity and, sort of succession planning over time and buy-in, quite frankly, for all of these concepts. So the involvement was really frontline folks who bring a certain set of information, the mid-level managers who make certain decisions for their agencies, and then the senior leadership, executive director, executive team, what have you. So having folks in all levels of the organization doing all parts of the work seems to really be effective and make a lot of sense. So this pilot program is underway now. It's going to be done by the end of June, and the next webinar is going to be talking about the results of all of that pilot work and the information that we've been able to gather from these 6 participants so that we can roll forward and improve on our continuous learning process to bring more folks into another cohort. So we're really excited about the next cohort. And with that, I think we're going forward with Liz, part 3. Oops. Maybe it's me, excuse me, it's a timeline. Okay, so we're going to continue alignment of the futures with the MPIs and ROMA, which I just talked about. We're going to include more CAPs, not just in the cohort, but we're also going to share more information so that everybody can be engaged in the process that we're working through. And then we'll be expanding our marketing and technical assistance. One of the things that we're coming up with as a part of the continual learning environment is that there are some toolkits that we're developing to put in our virtual toolbox that we'll be able to share with a lot of folks who are interested in maybe taking on this work themselves. So we'll be able to share that a lot more broadly than we have in the past, and we're excited about having that platform available and opportunities like this to talk in more detail to hopefully plant our seeds across the states and other parts of the country who might want to continue to focus on this work. So now it's Liz's turn because she, of course, is one of our stellar early adopters.
So Liz, you should be on. So, Liz, you're currently muted. We're still not able to hear you, but we are going to try.
Oh, I am so sorry. That was my personal mute, and I just figured that out. Thank you so much.
Okay, thank you.
So, again, Community Action of Skagit County is small in population, northwest corner of the state. Community Action of Skagit County serves over 30,000 households a year, and we got our story is walking alongside this whole process that you've been hearing about, participating in parts of it, and then bringing it back and then trying to internalize it in real time as we're learning about how to better measure our results and plan using this theory of change. And so it's not like we were handed a theory of change and asked to go do something with it. We were a part of the development, and Bill and I, our executive director, and I would bring things back. And where that really got processed is in our transformation team. And as Claire mentioned, this involvement of frontline staff, mid-level managers, senior directors, that's what we did, taking some cues from other partners in Idaho and other parts of the country. That suggestion of saying, hey, you need a group to lead this. So the transformation team is, number one, our board's partner in strategic planning. Number two, it's the think tank and accountability body on how we integrate this stuff. And the transformation team currently meets monthly. It's got entry-level WIC clerk. We've got coordinators in our veterans programs. We've got direct line staff from energy assistance. We've got division directors, fund development, executive directors. And the key is that these are early adopters. So rather than asking our leadership team to take the lead, and that's all of our supervisors and managers, we cherry-pick the folks who were the key informants and ambassadors within their particular areas that others trust and listen to when change needs to happen. And so the transformation team is really who led this in our organization. One of the first things that was an organizational commitment was to take some of our CSBG dollars and put that into my position. Community engagement manager is new as of 2012 to have some strategic thinking and leadership just on the community side of the theory of change. And this is before we had a theory of change. This was like a full year before this all came together. Community Action of Skagit County figured that out. We've also since then, in just the last couple of months, transformed our adult education coordinator position into a manager of adult education and workforce development. And under that, we're including our GED and ESL, but also newly, finally found a home for the financial education that we've been doing in bursts and starts. So we've really said, okay, if these are going to be our strategies, we need the leadership in place to help carry that forward. We have been working, and our agency, our direct service folks in energy assistance and others have been working really hard over the years to break down silos or build bridges between programs. That's gotten even more robust and intentional with procedures of how do we do a warm handoff of a WIC family to adult education? How do we build in financial education into each one of those energy assistance appointments, and so on and so forth. We set strategic priorities, and this is a snapshot of what our strategic plan looks like. We used to do our strategic plan once a year based by program. What is the Volunteer Center going to do? What is WIC going to do? How is our food distribution center changing lives? Now we no longer plan that way. Our planning at the topmost level is around our client outcomes, that theme of better lives, and again, you'll see we're trying to use that language consistently to stabilize and equip, and we've essentially got all of the bubbles of the theory of change as our key strategic priorities for individuals and families. And we have an entire community side to the strategic plan. And this is where we engage those individuals and churches and civic groups. Oops, I got it backwards. Let me erase that. Never mind. It's the other way around. Engagement is with individuals, individual community members, churches, and so on. And then the coordination and catalyst for change is the coalition work and the strategic initiatives to address specific issues. Now, at a work plan level, you know, this is very high level. This is the kind of stuff that is hanging up on displays in each one of our work areas in the agency, where we stand there and we talk about it during our stand-up meetings, pointing to how it is that a particular program is getting this stuff done. We report out it as dashboards, because each program then, the program manager or coordinator, has gone back to their team and said, what are our measures for this? Based on these best practices that we're getting from Oregon and what we should be measuring, based on what we have to measure because our funders and others make us do it, how is it that we're doing is achieving some of these goals? And I'll tell you one specific example. So, Volunteer Center. We run the Volunteer Center for the whole community. We connect volunteers with 160 nonprofits. That's a part of our community engagement work. It's also the front door to volunteerism at our own agency. We took a serious look at this and realized, aha, employability. How are we helping people build their resumes? We know folks are coming in the door asking for volunteer experience to build their skills and their resumes. So programmatically, what do we have in place? We're doing this work incidentally. How do we do it strategically? What do we have to have in place to connect our volunteer center to our adult education and workforce development staff? We were not asking that question before. And now that's what each of our programs is doing. So even direct service programs are thinking about what's our role in community engagement or in the coalition work to address some of these big issues. And you'll notice our strategic plan, our strategic priorities also includes the high impact organization, the third leg, that internal leg of the community action model. And my last anecdote on this would be, this has influenced us so much that it's even driving our capital campaign. And we've got a new building in mind, an existing building. And when we look at how we physically lay out the space and what is the customer's experience walking in the door, how do they know this is a place to not just get their basic needs met, but a place where they can set a goal for their future and achieve what they want for education, employment, and the success of their family to move forward? So those are some examples of how we've internalized and integrated and put some of this work to work, even while the theory of change was in practice. So Claire, would you like to talk about how folks can engage in it?
Which of course we heard about earlier is a great way to stay connected. We have 3 more webinars coming up that will each take this, sort of high-level overview and get more and more specific on the work on the ground around our theory of change and our indicators, measurement tools, and that sort of thing. And then, of course, there's going to be a futures workshop at the national conference in Philadelphia, so you could attend that and talk with some of our steering committee members and some other folks about how they're getting the work done and what their perspective is on how you might be able to potentially learn from what we're learning and take advantage of that. So next slide. And now we're open for questions and answers. If anybody has anything they'd like to know more about. Hyacinth, are there any questions that came in at all during the chat or anything that we need to take a look at? I don't see anything.
Yeah, so this is Tiffany, and one question that came up relates to how your local theory of change relates to the National Community Action Theory of Change. Is there a perspective that you can share with the audience related to that?
Liz, you want to take that?
If you're speaking, you're maybe muted again.
Hey, Liz, are you there? Can you hear me now?
Yes, I can hear now. So this is Liz, and so I think the national theory of change and what we were doing on the ground are kind of parallel projects, and you can think about what we're doing as testing that national theory of change in real time, and we were always coming back to what was already done before. So we were always coming back to Roma, and we were always coming back to these other models. And I think that what we did is we said, taking these great ideas, this is what it looks like on the ground for us. So, again, just as our individual theory of change, the three-state theory of change is not prescriptive. It's not telling every community action agency what they must do, but it's getting a framework for what we think success looks like. And likewise, my feeling on it is the national theory of change is also meant to be flexible in that way, and as we grow and learn, you can adapt it to how it might work best in your local community.
I think that's the primary reason why our work is so iterative just generally. I think we all can acknowledge that we do business differently, we can collect data differently, and we all need, information to come to us in different ways in order to serve, the needs of our communities. And so a lot of the work that shows up in the OSU report, and then of course that's, relates to the theory of change work, sort of stands behind that or illustrates that in terms of its broad approach with learning at the heart of it.
Okay, thank you.
Any other questions?
Oh, here's another question, and it is, are the shared measures of success and indicators included in the report? Are the tools that basically your collaborative uses to track the 13 indicators available? And really, I guess my follow-up question to that is, can you again speak about those indicators in relation to the national performance indicators? And I asked that question knowing that, okay, so we have our national performance indicators, that's the shared indicators that we as a national network use to talk about impact or our success. In addition to that, local agencies or local communities can have additional indicators as well, and so in addition to those national ones. But can you talk about sort of your indicators in relation to the national ones? But if we go back to that question, the original question, because I'll say it again, because the screen just moved. Are the shared measures of success and indicators included in the report, and are the tools that you all use to track the 13 indicators available? That's the question.
So
yeah, so the exciting,
I'm sorry, I want Claire to address that from the report side of it, but let me just give a quick example, and then maybe what she says will give sort of the broader answer to it. But in a really localized example, so we have in front of you our new theory of change. And we have existing NPIs on community engagement, right? Total number of volunteers, volunteer hours, advocacy activities, dollars raised for community improvements, things like that, right? We've got those NPIs already, even though we didn't call it the community side of the theory of change, they exist. And those are aligned with this model in terms of, just let's give the example of volunteerism, that we want these engaged community members, right? So just on that volunteer, we're still reporting out. We're not doing something different, but what it's challenged us to say is, what is the meaningful data? Total number of volunteers and total number of volunteer hours is what the NPIs are asking us, but that's not answering the question, do we have a more engaged community committed to changing attitudes and practices towards the poor? So it's an output the MPI is asking us for. And we are challenged then at the local level of how do we measure that as an outcome? How do we know that we're changing attitudes and practices towards the poor? And how does volunteerism work with that? So for us, what we're measuring is, yes, we measure volunteer hours and volunteer numbers and increases and that sort of thing. And yes, we track how many people have we educated in the community about poverty. And yes, we're tracking our advocacy activities and the philanthropy. What we're measuring locally is, to define engagement, is what's the conversion rate between those? How is, if someone, if we give a presentation at a church or to a Rotary Club, does that person end up volunteering? If somebody donates to us for their first time they come to a fundraising event or Spirit of Hope breakfast, do they then sign up for our advocacy trip down to Olympia for our lobby day? And so we're actually measuring deepening relationships over time and the conversion rates between our community engagement strategies. So for us locally, our community engagement strategy, this piece right here down in the left-hand corner, we're measuring community education outcomes, volunteerism, advocacy, and philanthropy, and coalition work, and we're looking at what's the conversion rate between those over time. So there's an existing NPI, but we have said, how do we make that data meaningful to us locally? Now the challenges to that is data collection, because currently we're still struggling to get all of our volunteers in the same database with our donors, you know, so that we can actually run reports on this. And so that's where, like, what Idaho is doing and others is really important, because, for example, another change for us is we're moving from CSST, the client whatever statistic system, the tracking system, the database, we're moving from that to the new Empower system. So we're building this theory of change into Empower. So how are we looking at how well we're connecting folks who might enter on the stability side, how are we helping them move to the equip side, and vice versa, and we're looking at how to measure that for community engagement. So there's a very localized example, and I think Claire can speak more to the connection between the outcomes listed in the report and other national measures.
Yeah, so the information is definitely available in the report. So it goes into quite a bit of detail about all of the different indicators and outcomes and dimensions. And it also begins to cross-reference to CSBG-related indicators. But more importantly, over time, as we've refined some of our metrics and indicators, we have also developed a direct crosswalk between our indicators and the NPI-ROMA work, which is really, really helpful. And that's what has allowed the 3 states to really agree on how we're going to go forward with this regional data collection effort in a really succinct way, where we're all using the same language, all using the same information to try to, take a big chunk out of the data collection work. What this means, though, is a little bit of what Liz said, and that is that not all of the NPIs are a direct match. Not everybody is collecting everything, but we have identified 18 or 19 that are really direct matches, right? So that we look at the outcome side a little bit differently, but basically they're very similar. And then we have about 4 or 5 more that we think are close enough that we're going to go ahead and collect them as well. So with the crosswalk information that we've developed just very recently to start looking at the new indicators, coupled with the report, we're feeling pretty solid that we are all looking at the best of what's happening nationally and then sort of augmenting it with our work, as Liz also said, around the outcomes piece. So we're happy to share any of these tools that would be helpful to anybody who's interested, but we definitely have quite a bit of information available.
And so a follow-up question to that is, so like speaking of like the annual report data that has to be submitted, then are you all basically reporting all of the data one time and you have a system that then extracts the data, that is needed, that needs to go up to the states, or, what does that look like? Or are you entering the data in more than one place, or how does that look?
Messy.
Yeah, I was just going to say yes and yes.
Yes. Yeah, and so, for example, like right now when we report out on our NPIs, that's a report, it's not a data collection tool, right? So it's an activity that one of our division directors does, is to come to all of our different programs that are using all kinds of different data and reporting systems for different state systems, adult education, energy assistance, and all of that. We do have that one CSST database where there's a lot of the client information, but we've not been collecting community engagement and the community work data there. So it's still kind of back of the napkin and pulling things from different areas in terms of it's not like we can ask our database, one database, to do a download of all of this information to the NPI. So there's still quite a bit of art to it, even though we're trying to get more science involved.
And I think the other thing that I would add is that one of the there's a group of findings, if you will, that the OSU report calls out about how everybody is collecting their data currently. And as you can imagine that, all of the agencies in the 3 states and across the country are collecting all kinds of data, but not all the systems make it easy to query the data and manipulate it, for meaningful uses and whatnot. So we also know that data collection is not systematic. We know that some agencies are using spreadsheets and some are using databases, and it's a really wide range, which is the primary reason why we launched the pilot approach so that we could take these 6 agencies, 2 from each state, and help them work through identifying what their process needs to be, because I can speak for Oregon to say that there's not probably going to be the day when we're able to purchase a new statewide software platform to mirror, what we're trying to accomplish here with these metrics and indicators to launch, right? So we all have to learn how to do what we want to do, tell the story we want to tell, collect what we want to collect with existing resources in some ways. And so every agency is coming through this learning process, this cohort, if you will, of the pilot program, to identify their abilities, their gaps, their approaches to try to collect what they need to collect and then tell their own story. So, so the pilot program for us is really pivotal in terms of how we learn to roll this out in a bigger way. So to underscore Liz's comment, it is messy and it's different from place to place, and we don't have anything that is systematic at this point and probably won't. But we want to use what we have and get better with it, right? That's sort of the simplest goal.
And I'd like to emphasize as well that this is active learning and continuous improvement, and part of the purpose of this isn't to come out with one theory of change and one set of indicators to rule them all. We know that we will have that. There is going to be something like ROMA or something like NPIs required of all of us, as long as there's a community action agency. And we might need to learn different things at the local level. So, it's really asking the question, what do we need to know to do our work better? And here's a model and a place to start. And, eventually data systems might all get to be exactly the same. But until then, it's the question of, rather than just responding and reporting out on outputs because we're being asked for them from CSBG or from a state agency or from a funder, rather than reporting out on just what we're being asked for in terms of outputs, what are we really trying to change in our community, and can we use this theory of change as a way to have meaningful continuous improvement and learning on the ground here? And so that's how we came up with that we're measuring community engagement as conversion rates between community education, volunteerism, advocacy, and philanthropy, because that's what we want to know and learn from, and it works with this model. It doesn't mean that we hope someday that we're going to make every community action agency have the same strategies as we have for community engagement. It means that's how we're applying it locally.
Thank you very much. So here's a new question, and it is, how would this data or information be compared throughout the state, rural, suburban, et cetera?
I'm sorry, it was a question about how is the data itself comparing, like the results? The client and community outcomes, or because I'm not sure that we can say that yet. I think we're still in the pilot phase.
We might have, it was actually Brewer who asked the question. So Ashley, if you could clarify your question, but currently how it reads is, how would this data or information be compared throughout the state, rural to rural or suburban, et cetera? And we'll see what she has to offer. So Ashley, you say yes, but you say yes to what? So if you could clarify so that they can answer, and while we're trying to get that clarified, we'll go to the next question, and that comes from Jeff Sargent, and his question is, beyond volunteering, have there been successful strategies in the test markets to get community partners on board with this CAA model? We collaborate now, but this appears to be much more. Partners have other missions, competing funding sources, et cetera.
Well, this is Liz, and I'll, again, just give an example from the ground, and then maybe Claire can make some suggestions based on the research. So, yeah, we're looking at this theory of change as a community's model. Like, this is what needs to be in place for success for clients and success for community as an entire community model. But we're not going out there trying to sell this to our partners to buy into it necessarily. We're using the lingo, so we're kind of indoctrinating people along the way. What this is it's a really awesome tool to use with things that we're already doing. So, for example, community needs assessment. We can look at our community needs assessment and say, year after year, adult dental care continues to be the highest importance, lowest availability service as reported by low-income families themselves. And we can also show how affordable housing is making it so people can't afford other things in their world, right? So those are pieces of data where we can take this theory of change as an image or just in a conversation to say, hey, you know, community action if Skagit County does not want to go into the business of doing adult dental care. We don't want to open a dental clinic. We don't have the capacity for that. We're not in that healthcare world like that. But we see it's a need and it's a gap. And here's the parts of this community diagram that let's say our community health center partner is doing well, or the Skagit Dental Society. This is what you're doing well around basic health care and things like that. So if this is a need, how do we work together to come up with solutions? And sometimes community action holds that torch and we help pilot something, like we're kind of the front door to dental services and coordinating donated care. But it shows that we don't want to be the 500-pound gorilla in the room and take over and do all of these things. We're helping to identify a gap of what we need for a healthy community. How can we work together, and then maybe find a partner to hand that off to, or somebody else who's better positioned to do that. So, for example, again on the community side, you know, housing, affordable housing is a crisis in our community. There's not enough multifamily housing being built. And we address that with our partners in trying to get the city council to do zoning or this or that, where we might step into housing development, and there are already partners doing that, Catholic Community Services and other groups, Mercy Housing. So we look at what are their strengths and what niche are they serving, and how can we help them advise us about where our niche might be, because we may not we don't necessarily have to serve every segment of that population, for example. So I think it's a starting point for the conversation. And one more example that I give is that in our community engagement strategy, there is a little bit of indoctrination in it. As community engagement manager, I help out with a lot of this coalition work. So we have in our strategic plan, we had listed on the community side on this coordinated and catalyst for change. This is a high-level strategy in our strategic plan. But in my annual work plan, one of the goals that the transformation team helped me come up with is if we're committed to these coalitions helping to carry some of these community conversations forward and helping to co-lead in solutions where we're not the only player, then we need our coalitions to be more functional. And so because of some of the background that I have, I've been doing workshops with coalitions on the difference between being a network and being a coordination group and being a coalition, and how to do strategic planning and set high-level community outcomes in these areas together. And I was asked to do a strategic planning session with one of our partner food banks. So we don't run a food bank, but we run the food distribution center. And because of all this coalition work that we've been doing, Helping Hands Food Bank invited me in last Friday to do a retreat with them and help them solidify what their strategic plan is going to be. So I led them through a vision, mission, values process, and the start of a theory of change and a start of a logic model. And they ended up coming up with the same stuff, that they've got the client side of outcomes they want and they've got the community side. And they see how we're working together on that. And they've got their niche and we and other partners have our niche. So they're actually building it into their plan to have both sides of this theory of change. And that wasn't me going out and trying to sell it to them like, hey, everybody, buy into community action's theory of change. It was me facilitating their own process and applying the model on top of it and then nodding their heads and going, yep, that makes a lot of sense.
Thank you very much. We have one final question, and then we're going to wrap up. That question is from Ashley Brewer. She has restated her question to be, how can we determine the effectiveness of the programs that are being provided? Is the data compared based on the size or location of the community or by the state as a whole?
Claire, you want to take that one?
Yeah, I'll just chime in. Sort of from our state perspective, I think we don't know fully yet all of the ways we're going to be able to look at effectiveness. And I think that there are, 100 lenses that we could look through to try to answer that question. I would say that generally speaking, though, the hope for me as the state representative in all of this is that we are able to look at large-scale change as a group collectively over 3 full states, working on the same information, working from the same information, and then make some sorts of assessments about investment strategies. The idea that we might be able to look at a combination of interventions, for example, and determine which interventions might show more promise than others, because we have the data, because we know that they, as interventions individually, have been well researched, and we have that data in the report, the combination of those 2 things we hope will help us do more with less, be smarter with our allocations of funds, whatever they may be over time at the state level. So I don't think that we know exactly how powerful this will be, but I think it's our dream that the broad compilation of these shared metrics and data points will be impactful in a whole host of ways. And I don't think we know all of those ways yet. So I think there are lessons about geography, interventions themselves, all kinds of things that we hope will come out of it. But we won't know until some time passes and we actually have the data on the ground going through the processes that we're developing through the pilots.
Thank you very much. I think that is a good place to stop. Really, to the both of you, we want to say thank you for sharing today to give us the perspective as the network, understanding that this is a perspective and your region, so your 3 states, have engaged in a significant investment in this pilot to figure out what it means to do this work effectively, and we appreciate the opportunity that you have given to us to eavesdrop and to, see in some cases, the successes and maybe some of the setbacks in the process to inform our collective learning process. So this is the Learning Communities Resource Center, and, really our approach does heavily focus on that peer-to-peer engagement that promotes a deeper space for learning around promising practices, understanding that the whole notion of performance management plays a key role in moving families forward and out of poverty, or as you put it, exiting poverty. And so we look forward to tuning in the future in your series to hear more about your work as it evolves. And just want to say we appreciate you all making yourselves transparent and vulnerable during this process, understanding that there are a lot of moving parts as it relates to our national effort around educating the entire network around the national performance framework and approach, and then at the same time you're providing some on-the-ground examples and experimenting live for us around what this looks like and can look like for local communities thinking this way. And so thank you again, and I did want to offer one point of clarification. I think there was a statement at some point in the presentation related to the reporting of volunteer hours, and I'm not sure if it was in relation to the local approach or the national approach, but for those who are reporting in the national annual report process, the volunteer hours are not expressed through our national performance indicators, but in the agency capacity module, and there's more information on all of that stuff, all of the annual reports and annual reporting process, as well as our national performance framework on the NASCAST website, www.nascast.org. And so thank you again, Claire and Elizabeth, and we will just go ahead and announce the next segment of the series to take place on July the 11th, and we will talk about the what. How intriguing. So hopefully you all will tune in, and on September 18th, we will talk about the how, part 1, and September 27th, the how, part 2. So please mark your calendars, and we look forward to your participation. Also, we just want to announce that as a part of our financial empowerment effort, LCRC will be sponsoring a Your Money, Your Goals Train the Trainer event, part 2, on June the 19th at 1:00 p.m. And so for agencies who are looking for tools for case managers who are offering financial empowerment support for families, feel free to tune in to learn more about that toolkit and strategies for strengthening your supportive efforts in that regard. And then on June the 22nd, the Health Intersection Learning Community Group will be meeting at 11 a.m. Eastern Time, and that particular segment is open. All these webinars are open to the entire network. It will focus on health and substance abuse, and we know that in many of our communities around the nation that substance abuse is becoming more and more prevalent, and during this session there will be some community examples offered as we think about ways to combat that. And finally, your feedback is extremely valuable. We need for you to take a few moments to click on the link provided to tell us how today's webinar went so that we might meet your needs more effectively. We thank you for your time and your effort. If you have need of any of us on the Learning Communities Resource Center's team, we invite you to contact us. Our email addresses are available there. We thank you again for your time. We thank our wonderful colleagues again from the Futures Project. Make it a great day.
Thanks, Tiffany.
Thank you.